on how we are going to use the EMR part now. So let me just straight away log in as a doctor. So it has come to the EMR page. This is the screen with which the doctor is going to update everything for the day. So here, when he clicks, he can look at the entire waiting room. Let's assume that out of this list he likes Sham and he wants to call Sham immediately. So you can just click on Sham and Sham's profile appears. Or say one of my friends, Anita, she just walked into my clinic, and I want to check for her details. Straight away it is there. I can look at Anita's all the last visits, what happened with each of the visits. So what are the examinations that I conducted, what is the diagnosis, what is the investigations that I ordered for, what is the treatment, what is the prescription that I gave, everything I can see here. uh, in fact, I can also look at the medical history of Anita, and if at all there are any allergies, that also can be seen. Okay, now Anita has come, and I have to fill this visit details here. So let me straight away come to the point. First I enter. Now this is the part which we have to finish in 60 seconds. Let's see whether we can. So Anita comes with the chest pain. So I'll enter chest pain here, and then say there is vomiting as well. Okay, now next is examination. So I will order for a ECG, TMT, and say cardiac examination. Uh, and here I can write anything at all. So any examination. So it's completely configurable. You can add anything and you can use it. So I will say normal. This is normal. Cardiac examinations abnormal. I'll say there is murmur that I heard. Then I'll go to investigations. So I'll order for a blood glucose. I will ask for a troponin test, and say here also you can search for tests. There are around 5,000 tests which are loaded here. You can call any one of them. Then there is a diagnosis. If I know the diagnosis right there, which is most unlikely, however, for the sake of this example, I will say myocardial. So yeah, so I'll put some diagnosis and I'll write anything here. Then treatment. So I'll say some lifestyle changes, some diet, or anything at all I can write here. This is the most important part, the prescription. So Anita has come to me before, and I will just pull her last prescription and I will load it in the system now. All right. Now these are all the medications that I had prescribed earlier. Now I don't like this one for her this visit. There is no point. Let me order any medicine here. Okay, I have ordered a medicine here, and I'll set up frequency. Now the system is very intelligent. It remembers your selections. Now you ordered for this Zyner 300 mg tablet. Now you mentioned 101 and before food and 5 days. Now next time when you order the same tablet, all of these fields will be pre-filled. You don't have to do a thing. Now let's assume that this set of medicine you would like to recommend to other patients as well. So we just save it as a template. Now the template name is automatically populated with whatever you had written during mentioning the patient condition. Now change the consultation charges if at all you want to, and then select the revisit date and time. Now go ahead and add and print EMR. I hope we have done it under 60 seconds. Yeah, in between I spoke about something, so because of which it might not have been 60 seconds, but usually you can. Now whatever you have entered, all of it is appearing here. This is the entire EMR of the patient. This is something called as a QR code, like you see it in airports. I'll tell you what it is and how it can be used later. So this logo here is something which you can change. this is what you have mentioned in your profile. So this is what you have entered for the patient. Now these are the set of medicines. Now you see Kannada here. Now let's assume that you have a say Gujarati patient. So let me just change it to Gujarati. If you go down here, everything has changed into Gujarati. Now you have the choice of printing the entire EMR or only the prescription. Let's assume that you're very lenient and want to give the entire EMR to the patient. So go out here. If you print, it will print. If you email, it will send an email to the patient if there is an email ID of the patient. SMS of the patient, SMS to the patient, just press and it will send a link to the patient, clicking upon which they can see either the EMR or prescription depending on what you have put. Now this is an interesting part, which is I have added one diagnostic center as my friend. So let me just select that. Now this case is straight away referred to a diagnostic center which I own, or a diagnostic center where I usually send patients to whose results I trust. Similar way, I go here and I will select pharmacy here. Now the pharma retail pharmacy that you select and refer here, they will be able to see only the prescription and nothing else. If you refer it to a diagnostic, they will be able to see only the investigation orders and nothing else. Now that we have seen all of this, let me just go back. Okay, one very important feature, which is let's assume that after booking the appointment, every time after booking the appointment and patient arrives at the hospital, patient gets an SMS. In this SMS, there is a link wherein they can upload all their old reports. So you can look at all those reports here. Now, after referring the case to a diagnostic, you can basically see the test results updated here by the diagnostic. Or you can also refer the case to a diagnostic right from here. Right? I'm just cancelling it now. Now, once the reports are updated, you can come to this trend analysis. You can see all the values. Now I'll remove postprandial and all of this, and I'll keep only things which I'm interested in. Right? And I can see the trend here. I can see the values also here. If you slightly come down, you can also see the prescriptions that you gave over a period of time for this patient. And you can also see how the values are changing depending on the prescription. You can update all of these content, blood glucose and everything, just by doing add. You can mention the date and mention all of these fields, or the patient or the receptionist can also do these changes on their own. So I think that's really it. So in addition, there are a lot of other features which I think we will explain time to time. But for now, okay, this is an important feature, payments. Now, the moment you enter a EMR at the reception, the receptionist will be able to see all of these payments to be collected by her. Let's assume that Anita Gupta, you asked to collect 500. The patient has gone to the receptionist. She will collect 500 and she will turn it into paid. Not to mention, you can delete any of these transactions if it is incorrect. Sorry, pardon my language. And in addition, you can also add blogs and videos which will be shown on the community of doctors. Now, others can learn from you. They can look at this is your home screen. So I just clicked here and it came here. Now, this is a graphical representation of how many patients are visiting you. And here you can just mention the email ID and mobile number and send. It will send your appointment link to the patient. This shows your today's appointments. Cases received are, the questions the patient asks. In addition to that, you can look at blogs, events, the events that comes up, and you can in fact register for an event straight away from here. These are all additional features if you want to use. Videos, you can look at other doctors' videos, and you can look at fellowships and jobs, and you can post some fellowships and jobs as well. Here you can build a website if you like to. That's an additional thing that is available if at all you want. So that's really, it's a very simple system. We want to keep it simple. If you have any questions now, then please, feel free to get back to us. We would be more than happy to support in all the different ways. We can be reached by sending a mail to medical at medisense.me, or you can straight away give a call to 70266 46022. Thank you so much for watching, and we look forward to supporting you in all the way possible. Thank you.